Okay, so hello everyone, this is the part second of the Meninges series which I have already started. So let me just check, am I audible, is the screen clear, so that we can start the session. Myself Dr. Monalisa. So in this session we are going to discuss the part second of the Meninges of the Brain targeting NEET PG 2022 examination. Okay, so yes, I am audible. So before starting this session, I would like to give you the brief about the platform and how the session goes on. So I have done my MD Anatomy from Armed Force Medical College, Pune, and I am the educator of anatomy subject on the platform of Unacademy. So before starting the session, let's talk about some of the important features which is only available on the Unacademy platform. What is it? It's the special class feature which I want you to tell that it's an interactive live session where the learners and the educators can interact. Polls are conducted among the learners, which is highly beneficial for them. So talk to your educators right itself when the session is going on and get your doubts clear right itself. Get notified about the upcoming session, which will be highly beneficial for you. What happens if you start seeing the educator sessions and you start following the educator on the Unacademy app, you will get notification regarding all the sessions taken by the educator, whether it is on free platform or plus course. Lecture notes. So once the session is finished, you can also download the PDF notes. That will be highly beneficial. Attend the live session, participate in live chats and get your doubts clear right itself in the session. Now let's talk about the free session. So I would also like to give you the information of the free session. Like today, after completing the session of the YouTube, that is Meninges of the Brain second part, I would start a session of that is orientation session for the next 2023. I will discuss few clinical anatomy MCQs and how it is getting twisted and how the direct MCQ is turned into a clinical anatomy MCQs. So that all will be discussed. Exactly the timing is 7:30 PM and 14th December, today itself. So 7:30 PM is the timing and 14th December we are going to start the session. So use the code NAT10 to unlock and get 10% discount on the subscription. So if you want to take the subscription of Unacademy, you can use my code NAT10 and you can avail a discount of 10%, which will be highly beneficial for you. So this is my referral code and unlock code. So do present for the 7:30 PM today itself on the Unacademy app. Download the Unacademy app and do present. The link will be provided on Let's Crack NEET PG Telegram group on INICT Unacademy Telegram group. So yes, now talking about the plus subscription. When I am talking about the plus subscription, all 19 subjects are completed in a very systematic way. You can access both live and recorded version. You can study from top educators of the medical field and you can be the part of competitive tests and quizzes. Study on the device of your choice and you can access more than 25,000 MCQs, which will be highly beneficial for you. So just go for it and grab this opportunity, and soon with 1 year of subscription and more, you will be provided with the printed notes of the plus course of Unacademy. So grab this opportunity. What I told you, this is a very important point which I want to focus once more. 25,000 MCQs which is made on the current scenario of the MCQs which is going to be asked, clinical MCQs of all 19 subject, and this will give you a better rank. So just go and take the subscription. It will be highly beneficial. So I would also like to tell you about the iconic subscription. So when I am talking about iconic subscription, I mean to tell that you are getting the benefits of plus course of Unacademy. Along with it, you are also getting the benefits of the prep ladder. That means you get the benefits of the clinical integrated essentials video lectures, which is done by the dream team of Unacademy. QBank 3 can be assessed, rapid revision snapshots and dream notes. Okay, dream notes of the printed notes of the prep ladder can be assessed by you. So these are the benefits which can be assessed by you. So just grab this opportunity. And I would like to give you the information that I am starting from tomorrow Focus FMG 2022 comprehensive batch. So my dear aspirants, I am starting Focus FMG 2022 comprehensive batch. So do be the part of this session. If you are interested for completing your course and you are targeting your FMG examination, be the part of this. Take the plus subscription and use my code NAT10 to get an additional discount of 10%. So this will be highly beneficial, my dear aspirants. I would also like to tell you about the Plus and Iconic subscription merging, which is the NEET PG subscription, where you can have the comparison of both the Plus and the Iconic. So you can use my code again for getting 10% discount. That means an additional discount of 10%. A total of more than 20% discount is there. So this is the pricing detail, and just go grab the opportunity of taking the subscription. This will be highly beneficial for you. So you can use this code and add 10. So let's start with the session. So as I told you, this is the Meninges session part second. This is the Meninges session part second, where I want you to give the basic idea of what all things are very important for you, and you should sure target this. Okay. So if we talk about the previous session, that was Meninges part 1, which we have already completed. In that session, we have already completed the dural folds, the dural septors, and the dural venous sinuses. In this session, I will cover up the Arcanoid layer, the Pyromater, and the Subarcanoid System, and the cavernous sinus. So these are the topics to be completed in this session. So let's start with this. So my dear aspirants, I would like to show you the Arcanoid Matter. What is Arcanoid Matter? Actually, this is the second layer, which is if we talk about the Meninges is made of 3 layers as we proceed from outside to inside. It is dura, arcanoid, and pia. So this is transparent membrane, which is exactly located between the pia and the dura, and it is loosely investing the brain surface. It is also continuous with the spinal arcanoid matter, and that continuation of cranial arcanoid matter with that of spinal arcanoid matter occurs at the level of second sacral vertebra. Now, so here you can see this is the Arcanoid layer, which I am highlighting it. This is the Arcanoid matter in between dura. So if I talk about dura and in between the Arcanoid matter and Arcanoid granulation, there is subdural space. What is lying here? There is a subdural space which is located in between the dura and that of the Arcanoid layer, and below the Arcanoid layer we have got subarcanoid space. So below the Arcanoid layer you can clearly see there is subarcanoid space located. So this space, my dear aspirant, this is the subarcanoid space which you are seeing in between the pia and the arcanoid. This is subarcanoid space, and below this there is a layer. This will be the Pyromater. This will be the Pyromater. So this is how you can define. So from outside to inside, this is the dura matter, the outermost layer. Then we have got subarcanoid space. Then we have got the arcanoid matter. The next layer is the arcanoid matter. Then we have got the subarcanoid space. Okay, so let's write few things about this. What does the subdural space contain? So actually it is lying between the meningeal layer of dura matter and that of arcanoid layer, and it contains cerebral veins which is traversing to reach the dural venous sinuses. So let's write about it. Arcanoid layer or the arcanoid matter. It is the thin transparent layer. It is thin transparent membrane, and the exact location of this thin transparent membrane is between the Pyromater and the meningeal dura matter. Okay. Now let's talk about the Arcanoid matter details. So let's talk about the Arcanoid matter detail. Arcanoid matter loosely invests the brain. It is loosely attached to the brain surface. It is loosely investing the brain, and it is continuous as spinal arcanoid matter. It is continuous as spinal arcanoid matter. And the level where it is continuous is the level of foramen magnum. So it is continuous at the level of foramen magnum. It is continuous as above it is foramen magnum, below it is continuous with the arcanoid matter and will go lower down till the level of second sacral vertebrae. Got it? Second sacral vertebrae. Now coming to the subdural space. So when we are talking about subdural space, The subdural space is exactly lying between the meningeal layer of the dura and that of the arcanoid matter, and it contains cerebral veins which is lying on the way to drain into devious. What is devious? Dural venous sinuses. So that is dural venous sinus. So it is traversing ultimately to reach the dural venous sinuses. Subdural space is containing the cerebral vein which is traversing through it. Ultimately it will reach the space of dural venous sinuses. Okay. So this is the important point, which is the subdural space and the cerebral veins are draining into the dural venous sinuses, and this is the location of the this is the structure cerebral vein which is located in the subdural space. Now talking about the processes of arcanoid matter, let us talk about the processes of arcanoid matter. Processes of arcanoid matter. Processes of arcanoid matter. So when we are talking about the processes of arcanoid matter, the processes are in the form of arcanoid villi. It is having arcanoid villi, which is a finger like process and which is arising from the surface of arcanoid matter. Okay, so this is a finger like process which arises from the surface of arcanoid matter, and what does they will do? So what does this layer will confine? So they will push the dura before and eventually will perforate into dural venous sinus. So actually what happens, arcanoid villi is pushing the dura. Arcanoid villi is pushing the dura and ultimately it will perforate into dural venous sinus. So that means arcanoid villi will perforate the dural venous sinuses. Dural venous sinuses. They are actually, when you will see this arcanoid villi, they are actually covered by specialized mesothelial cells which convey. What is the function of arcanoid villi? This is covered by specialized mesothelial cells which convey the cerebrospinal fluid to the bloodstream, thus leading to the process of absorption of CSF. Arcanoid villi is most numerous in number in superior sagittal sinus. So these are certain important features of arcanoid villi. So please write down. Arcanoid villi are covered by specialized, arcanoid villi is covered by specialized mesothelial cells, which convey the CSF to bloodstream. It is conveying the CSF to the bloodstream. It conveys the CSF to bloodstream. Thus leading to this absorption of this process thus leading to the absorption of CSF. So it will lead to the absorption of CSF. And the other important point is that the maximum number of, if I talk about the arcanoid villi, the next important point is arcanoid villi maximum number. Can anybody want to give the answer? Where is the maximum number of arcanoid villi located? The answer is triple S. What is it? Superior sagittal sinus. So arcanoid villi is maximum in number in superior sagittal sinus. Okay. So arcanoid matter and subarcanoid space. So we have discussed the details of arcanoid matter. Other important point is that arcanoid granulations also we have discussed. So can anybody tell me what is the other name of arcanoid granulation? What is the other typical name which is used for arcanoid granulation? So actually arcanoid granulations are also called as Paconian bodies. The function is absorption of CSF. The function is absorption of CSF. And where does they are located and projected? So venous lacunae of dural venous sinus, most common is superior sagittal sinus. So they are present in dural venous sinus, most common is the superior sagittal sinus, they project. So they are projected from this arcanoid layer called as arcanoid granulation or Paconian bodies. So my dear aspirants, one more thing I want to explain, actually what do you mean by the word subarcanoid? If I talk about the word subarcanoid space, so all of you must be knowing that subarcanoid space is the space which is residing between, so subarcanoid space is the space which is residing between the arcanoid layer and the Pyromater. Actually at certain places, for example where the spinal cord is ending, below that it is forming a substantial amount of CSF is lying between the arcanoid and the Pya. So there it is called as lumbar cistern. So wherever there is, good evening Abdul Salam, good evening Abdul. So wherever we have got substantial amount of CSF which is lying in the space below arcanoid matter, that means between the arcanoid matter and Pyromater, that space is called as subarcanoid cistern. That space is called as subarcanoid cistern. So is the concept of subarcanoid cistern clear to you? So what is subarcanoid cistern? So just now I have told you subarcanoid cistern is the space which is lying between the arcanoid matter and the Pyromater, and substantial amount of CSF is located there, and a substantial amount of CSF is located there, and where it is having more amount of CSF, there we have got certain important structures also lying. We have got various important types of subarcanoid cistern. So I would like to brief all the important location of subarcanoid cistern. So let's one by one discuss it. So let's start with the first subarcanoid cistern, the most important one. So I will discuss the important subarcanoid cistern. Okay. So yes, I would like to discuss the quadriceps cistern or Cisterna ambiens. So my dear aspirants, so here what you can see, the quadriceps cistern is having many names. Okay, so let's discuss the first cistern, that is quadriceps cistern. So quadriceps cistern is also called as Cisterna ambiens. Please note down my dear aspirants, these are important for your MCQ session. The other name of quadriceps cistern is, it is also called as Cisterna ambiens, which is also called as superior cistern or cistern of great cerebral vein of Galen. So all these names are the names of a single cistern. So all these names which is written here, quadriceps cistern, the Cisterna ambiens, the superior cistern or cistern of great cerebral vein of Galen, all these are the names of cistern of a single cistern. The other names has been used. So exact location, the next important point for your MCQ is the location of quadriceps cistern, Cisterna ambiens or great cerebral vein of Galen cistern. It is located between the splenium of corpus callosum. What does that mean? It means the posterior end of corpus callosum. It is located between the splenium of corpus callosum, means the posterior end of corpus callosum, and superior surface of cerebellum. So exactly this is the location of quadriceps cistern, between posterior end of the corpus callosum, which is an example of commissural fibers connecting two side cerebral hemisphere, and superior surface of cerebellum. So let me show you the diagram of quadriceps cistern. So let me highlight this diagram. So I would like to highlight this diagram so that you can understand the location of quadriceps cistern. So all of you just concentrate on this diagram. So yes, so you can see here, let me highlight this with a quadriceps cistern. So can you see in this diagram, quadriceps cistern is highlighted with orange color. So one by one I will discuss each cistern. Can you appreciate? So let me just concentrate on quadriceps cistern. So all of you can visualize the quadriceps cistern, and what you can appreciate that quadriceps cistern, if you will see, it is exactly located in between. You can see here, this is the corpus callosum which you are seeing. This is the corpus callosum. Okay, so this part is splenium of corpus callosum. This is splenium of corpus callosum. This is splenium part of corpus callosum, and below it you can see the cerebellum. So this structure is the small brain or the cerebellum. So exactly between the splenium part of corpus callosum, and that of the cerebellum. This is the location of quadriceminal system. So is it clear to everyone the location of quadriceminal system, my dear aspirants? So this is the location of quadriceminal system which we have just now discussed. Now let's talk about the contents. So next important point for your MCQ session is that you should know the contents. So yes, okay. Okay, so yes, my dear aspirants, so yes, is it clear to everyone? Okay, so contents of quadriceminal system. So let's concentrate on quadriceminal system. The contents of quadriceminal systems are all these. So the contents are posterior cerebral artery, the contents are posterior cerebral artery, the contents are posterior choroidal arteries, okay, superior cerebellar arteries, trochlear nerve, venous confluences at the junction. So we have got vein of Galen, inferior sagittal sinus and straight sinus. Okay, the contents of quadriceminal systems are all of the following. So this is important for you that you should by heart all the structures which is located in quadriceminal system, which is also called as great cerebral vein of Galen system, which is also called as ambient system. And the important structure located is posterior cerebral artery, posterior choroidal artery, superior cerebellar arteries, trochlear nerve, confluences of the junction of sinuses where venous great vein of Galen is there, inferior sagittal sinus and straight sinus. So all these structures which has been enumerated here are the structures contained in the quadriceminal system. So is it clear? So let's move on to the next system. The next system which I want you to know is the second one, that is interpeduncular system. Interpeduncular system, the other name of interpeduncular system is, it is also called as basal system. It is also called as basal system. Where it is located? Interpeduncular system is also called as basal system and it is located in interpeduncular fossa. It is located in interpeduncular fossa. Okay. So interpeduncular system is called as basal system and it is located in interpeduncular fossa. What does it contains? What does it contains? It contains arterial circle of Willis as well as oculomotor nerve. It contains arterial circle of Willis and also contains oculomotor nerve. Interpeduncular system, which is called as basal system, the location is interpeduncular fossa. The location is interpeduncular fossa, which is lying on the basal base of the brain. It contains arterial circle of Willis and it also contains third cranial nerve. It also contains third cranial nerve, oculomotor nerve. It also contains third cranial nerve or oculomotor nerve. Okay, now I would like to show you the location of interpeduncular system. So let me again highlight this diagram. So the interpeduncular system is shown with a light blue color. Blue is highlighted in the blue color, and where it is located, as you know, the interpeduncular system is highlighted here. This is the interpeduncular system and this is exactly the location of interpeduncular system. This is the exact location of interpeduncular system. Okay, so this is exactly the location of interpeduncular system, which is located on the basal aspect or inferior view of the cerebral hemisphere. It contains circle of Willis. So let's talk about the other one. So the pontine system, the next system, the third system which is important for you to know is the location of pontine system. Pontine system is also called as Cisterna pontis. It is also called as Cisterna pontocerebellaris and it's a notable subarcanoid system lying on the ventral aspect of the pons. What does that mean? That means it is situated on the anterior aspect of the pons, and the important structure located here, many times it has been asked in the MCQ, is the basilar artery. So what is located in the pontine system? There is location of basilar artery is located in the pontine system. Pontine cistern, Cisterna pontines, located in the pontocerebellaris, notable subarachnoid cistern, located onto the ventral aspect of the pons, and it contains basilar artery. It contains basilar artery. Got it, everyone? Yes, Achilles, Dhawan, good evening, dear. Now, so pontine cistern. So, as you can see here, again if I highlight this diagram, you can clearly appreciate the pontine cistern has been shown with the yellow color. This is the pontine cistern and this is exactly the location. So, this structure is P for pons. So, okay, this is the pons and you can see pontine cistern is lying on the ventral aspect of the pons. Ashwani Mishra. So, are you understanding, everyone? Please let me know. So, pontine cistern containing basilar artery lying on the ventral aspect of the pons. Lying on the ventral aspect of the pons. Okay. Now, let us talk about Cisterna Magna. So, other important cistern which is again a big cistern location and containing substantial amount of CSF is called as Cerebromedullary System, which is also called as Cisterna Magna. So, this is called as cerebromedullary cistern. The other name of cerebromedullary cistern is Cisterna Magna. It is exactly located between the cerebellum and the dorsal surface of medulla oblongata. What is the location? Its location is, it is exactly located between the medulla oblongata dorsal surface, that means posterior aspect of medulla oblongata, and that of cerebellum. That is called as Cisterna Magna. Now, what happens? Other important point, I have already covered up the fourth ventricle, and you have seen in the roof of fourth ventricle there were apertures, there were lateral apertures and median apertures. What is the other name of median apertures? Can anybody tell me? What is the other name of median and lateral apertures of fourth ventricle? Anyone wants to reply? Median aperture is called as aperture of Magendie, aperture of Magendie, and lateral aperture is called as apertures of Luschka. Apertures of Luschka. So, through the apertures of Luschka and Magendie, which are present in the roof of inferior part of the roof of fourth ventricle, this will communicate. So, through the roof of fourth ventricle, through these two openings, that is the Magendie aperture and the Luschka aperture, one Magendie aperture and the two lateral apertures of Luschka, there will be communication between the ventricular system of the brain and the subarachnoid system. So, what does Cisterna Magna contains? Yes, Ashwani Mishra is absolutely right. It contains vertebral artery, it contains 9th, 10th, 11th and choroid plexus. What does Cisterna Magna or cerebromedullary cistern contains? Cisterna Magna or cerebromedullary cistern contains 9th, 10th, 11th cranial nerve and also contains choroid plexus. So, yes, done with this? Yeah, let us move on to the next one. So, before that I would like to show you Cisterna Magna. Okay, so let us focus, let me rub this and we will focus on the Cisterna Magna. So, let me just enlarge it. Yeah. So, yes, now we will focus on Cisterna Magna. So, in this diagram you can clearly see that Cisterna Magna has been shown you with a red color. This is Cisterna Magna, and what I told you, Cisterna Magna lies on the dorsal aspect of medulla. So, this is exactly the location of Cisterna Magna, and this structure is the medulla. So, yes, it is located on the dorsal aspect of the medulla and in between the cerebellum lying on the posterior aspect. So, this is Cisterna Magna, which is containing your nerves. It is related with the nerves, forming a communication between the roof of fourth ventricle, ventricular system and subarachnoid system, and it contains Cisterna Magna, as we have just now discussed. It contains the 9th, 10th, 11th nerve, choroid plexus and that of vertebral arteries. Let us talk about cisterna of lamina terminalis. Okay, so we know that lamina terminalis is related with the third ventricle. So, it is situated just rostral or anterior to the third ventricle. The location of this cistern is called as cisterna of lamina terminalis. The next important point is what does it contains. So, next important point is that what does it contain. So, it contains anterior cerebral artery, anterior communicating artery, hypothalamic arteries or Hubener arteries. All these points are important for your MCQs. The cisterna of lamina terminalis, which is lying rostral or anterior to third ventricle, it contains anterior cerebral, anterior communicating, hypothalamic or Hubener arteries and just rostral to third ventricle. Let me show you cisterna of lamina terminalis. So, okay, let's focus on cistern of lamina terminalis. Again, I will highlight this diagram, and in the light blue color, and you can see here, this is cisterna of lamina terminalis, and this is the location. It is located rostral to the cavity of third ventricle. Here somewhere will be the cavity of third ventricle. Here third ventricle, which is a cavity of diencephalon, thalamus and hypothalamus. Just anterior to it is the location of cisterna of lamina terminalis. Okay, so let's move on to the next. Pericalosal cistern. Pericalosal cistern is unpaired subarcanoid cistern, and it is containing pericalosal artery. It is containing pericalosal arteries. It lies between the superior aspect of the corpus callosum and inferior edge of the flux cerebri, extends between the genu and the splenium of corpus callosum. Actually, the anterior end of corpus callosum is called as genu, posterior end of corpus callosum is called as splenium. So, pericalosal, what do you mean by callosum? Corpus callosum. So, the location of pericalosal cistern is just above the corpus callosum. So, it is called as pericalosal cistern containing pericalosal artery. Pericalosal cistern. So, let me just show you pericalosal cistern here. So, yes. So, here I would use green color to show you the whole outline of the corpus callosum. This is corpus callosum. This is corpus callosum. Okay, this whole structure which you are seeing here is the corpus callosum, and just above it, as shown in pink color, this is the location of pericalosal cistern. This is the location of pericalosal cistern surrounding the superior aspect of corpus callosum, running from the genu end of corpus callosum to that of splenium part of corpus callosum. So, this is the whole extent of pericalosal cistern containing pericalosal arteries. Okay, let's talk about the next cistern. The next cistern is the chasmatic cistern. Chasmatic cistern. So, from the name only, it is clear that it will be lying very close to the optic chiasma, that is of the optic nerve. So, it contains anterior aspect of circle of Willis and optic nerve. Chasmatic cistern is also called as cistern of chiasma or supraciliar cistern. It is actually considered to be the extension of interpeduncular cistern. Interpeduncular cistern is located on the base of the brain, and it is running across the optic chiasma. So, actually the extension of interpeduncular cistern is called as chasmatic cistern. It is called as chasmatic cistern. It is the extension of interpeduncular cistern. So, yes, here you can see again, if I show you chasmatic cistern. So, what I told you, this is the chasmatic cistern, and this is actually in the extension of interpeduncular cistern. So, see here in this diagram, if I highlight it, you can see here, this is interpeduncular cistern and this is chasmatic cistern. Okay, so this is interpeduncular cistern and this is chasmatic cistern. So, what you can say, chasmatic cistern is the extension of interpeduncular cistern. Done? Now, let us move on to the next. Medullary cistern. So, medullary cistern again is located on the ventral aspect of medulla. It is an important cistern. It is containing vertebral artery, the pica artery. What is the full form of pica artery? Posterior inferior cerebellar artery. What is the full form, my dear aspirants? It is the posterior inferior cerebral artery, and we already know that posterior inferior cerebral artery is giving major blood supply to dorsolateral part of the medulla. So, medullary cistern, ventral aspect of the medulla containing a medullary cistern which contains pica artery, vertebral artery. We know that pica artery is a branch of vertebral artery. So, posterior inferior cerebral artery is branch of vertebral artery. Other branches of vertebral artery is also the content, and the other branches of vertebral artery is posterior and anterior spinal artery along with 12th cranial nerve. So, all these are important for your MCQ. These are the contents of medullary cistern. These are the contents of medullary cistern. So, yes. Here again, if I highlight this diagram, so yes, let me highlight the medullary cistern. This is the location of medullary cistern. This cistern, I am talking about this cistern, this is called as medullary cistern. This is medullary cistern, and this medullary cistern is lying on the anterior aspect of this structure. What is this structure? So, it is lying anterior to which structure? This structure. What is this? This is medulla. So, it is lying on the ventral aspect of the medulla, medullary cistern. Done. Now, coming to the next one. Okay, so I would also like to talk about few minor cistern, which location and contents you have to just know. One of the cistern, by the name already is clear, insular cistern or sylvius cistern. So, in the functional areas of the brain, what I have discussed, the stem of lateral sulcus, and we have discussed about the lateral sulcus. So, sylvian cistern or the lateral sulcus is the same name for both of the sulci, a very prominent sulci on the supralateral surface starting from the basal aspect of the brain. This is exactly between the frontal and the temporal lobe of cerebral hemisphere. So, it will contain, here there is the starting or the origin of middle cerebral arteries and the veins. So, it will contain middle cerebral artery, middle cerebral vein, fronto-orbital or collaterals to the basal vein. So, these are important structures which is located in the lateral insular or the sylvian cistern. Now, let us talk about cerebropontine angle cistern, cerebellopontine angle cistern. So, it is situated at the cerebellopontine angle. What do you mean by cerebropontine angle? The lateral angle formed between the cerebellum and the pons is called a cerebropontine angle, and the structures located here is the 7th cranial nerve is located here, the 8th cranial nerve is located here. We have also got anterior inferior cerebral artery located here, and we have got 5th cranial nerve located here. So, these are the structures which is containing the contents of cerebellopontine cistern. So, these are the structures located between the cerebellum and the pons. So, done with, in short, we have done with all the important cistern. There is one more cistern which is called as, I would like to explain. This is a small cistern. This cistern is supracerebellar cistern. Actually, it lies inferior to pineal gland. You have already seen in the posterior boundary of third ventricle. In the posterior boundary of third ventricle, we have got the pineal gland. So, just superior to pineal gland, we have got supracerebellar cistern. So, let me show you supracerebellar cistern. Okay. So, let me just show you again. I would like to highlight this diagram. So, exactly the supracerebellar cistern is this one, this is the supracerebral cistern, and this is exactly located in relation to just in the posterior boundary of third ventricle superior aspect. So, this is exactly the location of supracerebellar cistern. Done? So, yes, we have done with this. Now, I would like to tell you about the Pyromater, and then I will proceed with the cavernous sinus, very important topic for your MCQ session. Now, the Pyromater is the innermost layer of the, which is very much adherent to the cerebral hemisphere, and actually it is quite adherent, and it is not easy to peel off the Pyromater. It is adherent to the sulci and the gyri of cerebral hemisphere. It is a transparent vascular membrane closely investing the brain surface, and it dips in every sulci and the fold of cerebral hemisphere. So, if I highlight this diagram, what you can see, if I enlarge this diagram, the important things which can be visualized by you is, this is the edge. So, this layer which you are seeing is the arcanoid layer. This is the arcanoid layer, and when you remove the arcanoid layer, inside this surface is the PIA. This is the Pyromater. So, inside the structure which you are seeing, this one, this is PIA. So, this is very much difficult to remove from the surface of the brain surfaces. So, this is exactly the Pyromater which you are seeing, and this layer is the arcanoid layer. Okay. So, let us write about Pyromater. The Pyromater is a transparent vascular layer. It is a transparent vascular membrane closely invest the surface of the brain, and dips it dips in every sulcus, and forming a fold. This is important. Now, what about the processes of Pyromater? For example, when the session of spinal cord must be taken previously, so actually in the special classes I have taken the session of spinal cord Pya. So there you must have seen that Pyromater modification has been asked in MCQ. Pyromater modifications are phylum terminal, the glistling end, which is approximately of 20 centimeters. We have got ligamentum denticulatum, the tooth-like projections, which is also made of Pyromater. We have got subarcanoid. Subarcanoid septums, we have got these are posteromedian septum. So these are, and linea splendens, we have got linea splendens in the anteromedian fissure. Actually linea splendens, ligamentum denticulatum, posterior median septum, we have got phylum terminal. So these are modification of Pya in the case of spinal cord. Now if I talk about the modification of Pyromater in terms of cerebral hemisphere, so the modifications are, you can write down processes of Pyromater. So it is forming, actually processes of Pyromater is forming perivascular, it forms a perivascular sheath around the vessels, entering and leaving the brain surface. It is also forming septa, folds, and dipping into the sulci and fissures of the brain. Now it also forms a double fold of Pyromater that is called as stela chorioida of third and fourth ventricle. It also forms sheath around the cranial nerves. Okay, so yes, we have done with the Pyromater, we have done with subarcanoid cistern. Subarcanoid cistern is actually subarcanoid space dilated and filled with substantial amount of CSF. It is having a large pool of CSF which is acting as a water bed for the brain. So we have already discussed the important location of subarcanoid cistern and what all structure it contains, and we have done with the 3 layers of the meninges of the brain. Next, what I want you to discuss is the cavernous sinus, one of the dural venous sinus which is very important as considered to your MCQ sessions and your NEET PG examination is cavernous sinus. So I would like to tell you about its location and extent, its relation, structures passing through it, tributaries and applied aspect or clinical anatomy related to the topic. So this is how we will cover up the topic of cavernous sinus. Okay, so I will like to discuss these are points about cavernous sinus. So let's discuss it. So first thing is, what is cavernous sinus? Actually cavernous sinus is one of the dural venous sinus. It is formed by the separating of the layer of meningeal and endosteal layer of the dura mater. So it is formed by splitting of endosteal and the meningeal layer of dura mater, and it is exactly located. So what happens if you talk about cavernous sinus, its roof, lateral and medial wall is formed by the meningeal layer and the floor is formed by endosteal layer of dura mater. So yes, this is exactly the cavernous sinus has been shown in the diagram. Here you can see this is exactly the cavernous sinus outline, and this is exactly located. So this is exactly located, if you can see, you can appreciate, it is located in middle cranial fossa. So MCF, it is located in middle cranial fossa on either side of the body of sphenoid. And how it is formed? So what is the formation, how it is formed, cavernous sinus? So write down cavernous sinus is formed by separation of meningeal and endosteal layer of dura mater, meningeal and endosteal layer of dura mater. Here the roof, the lateral wall and the medial wall. The roof, lateral wall and medial wall is formed by the meningeal layer of dura mater, and the floor is formed by, if I talk about the floor is formed by endosteal layer of dura mater. It is formed by endosteal layer of dura mater. It is formed by endosteal layer of dura mater. Got it? Now let's talk about location and extent. So you can clearly see here the location of cavernous sinus on either side of the, it is located in middle cranial fossa on either side of the sphenoid body. And if you will see the extent, if I talk about its extent, it is extending from superior orbital fissure to that of the petrous temporal bone. So what is the extent? It is extending from the superior orbital fissure to that of petrous part of the temporal bone. So write down extent of cavernous sinus. Extent of cavernous sinus. Extent of cavernous sinus. It extends from superior orbital fissure to apex of petrous temporal bone posteriorly. Done? So actually if I talk about cavernous sinus, so it is a sinus filled venous blood. It contains, it's one of the dural venous sinus. It is a paired dural venous sinus which is containing venous blood which is having a covering of endothelial lining. So it is a sinus filled cavernous sinus, means it is a sinus filled venous blood connection lined by endothelium. Now next important point which is important for you to know is the relations of cavernous sinus, its communications, its tributaries. So let's talk about that. So firstly I would like to show you this diagram where you can appreciate the relations of cavernous sinus, So this blue color structure which you are seeing is the cavernous sinus. Which is having many trabecules inside. So here what you can say, the cavernous sinus, so this is the cavernous sinus which is shown, medially is related to pituitary gland and that of sphenoidal sinus. So medially it is related to pituitary gland and sphenoidal sinus, which is clear in this diagram. Other than that, you can see laterally, if you will see the extent of cavernous sinus on lateral, so it is having laterally okay, what happened? So yes, so temporal bone, when we are talking about temporal bone, so here you can see the temporal lobe of cerebral hemisphere. So this is lying in the lateral relation. We have got pituitary gland, M for medial relation, sphenoid sinus is also related medially. So this is quite clear here. Other than that, superiorly, if you will see, it is it is extending to the loop of internal carotid artery. Inferiorly, it is related with the sphenoid bone. So this is inferior, I for inferior. Internal carotid artery, if I talk about, so it is extending and relating to the superior aspect. So write down this relation, that important relation. So let's talk about that. Relations of cavernous sinus. Relations of cavernous sinus. Medially it is related to pituitary gland and that of body of sphenoid. Pituitary gland and body of sphenoid. Laterally it is related to uncus of temporal lobe of brain, uncus of temporal lobe of the brain, and also related to trigeminal ganglion lying in the cave trigeminal on the lateral aspect. So, these are medial relation and lateral relations of cavernous sinus. Now, let us talk about its superior and inferior relations. So, yes, superiorly cavernous sinus is related to loop of, you can say upper loop of internal carotid artery, which will form a carotid siphon. That loop is related. Inferiorly, as we have seen in the diagram, it is related to greater wing of sphenoid, greater wing of sphenoid. Thereafter, I would like to show you a diagram where you can appreciate the tributaries and the communications of cavernous sinus. You can appreciate the tributaries and the communications. So, let me show you a diagram for this. So, yes, my dear aspirants. So, actually if I talk about cavernous sinus, from where are the sources, from where it is draining the tributaries. So, actually these it collects blood from, so it is having, it takes blood from, so it is having a direct drainage of its tributaries are. Three sources are there. So, we have got the three sources. One is from the meningeal source, one is from the orbit, one is from the meninges, and the third is from the brain. So, these are the three sources, these are the three sources of the tributary. If I talk about the veins which are direct tributaries, this has been asked so many times in the MCQ. So, direct tributaries is from three sources: orbit, meninges, and the brain. The sources are superior ophthalmic vein, inferior ophthalmic vein, and central vein of the retina. The three sources are superior ophthalmic vein, inferior ophthalmic vein, and the central vein of the retina. From the meninges, the two sources are sphenoparietal sinus and middle meningeal vein. Yeah, hello Mulai. And from the brain, the source from the brain. Okay, from the brain. So, this is the source from meninges, this is the source from the orbit, this is the source from the brain. So, when I talk about the source of blood which is coming to that of the cavernous sinus, it is from two sources. The sources are superficial middle cerebral vein and inferior cerebral vein. Superficial middle cerebral vein and that of inferior cerebral vein. So, we have got three sources of blood which is draining into cavernous sinus from the orbit: superior ophthalmic vein, inferior ophthalmic vein, and central vein of the retina. From the meninges, sphenoparietal sinus, middle meningeal vein. From the brain, inferior cerebral vein and that of superficial middle cerebral vein. Now, if I talk about the communication, so this is one side cavernous sinus, this is other side cavernous sinus. The two side cavernous sinus is communicating, the two sides cavernous sinus is communicating with each other. This is called as intercavernous sinuses. Now, draining channel. So, we have got two draining channel. One is superior petrosal sinus, other is inferior petrosal sinus. Superior and inferior petrosal sinus is draining into transverse sinus, and that of inferior petrosal sinus will drain into sigmoid sinus. So, here what happens, inferior petrosal sinus will drain into sigmoid sinus and then into internal jugular vein. The superior petrosal sinus will drain into transverse sinus. Also, cavernous sinus via basilar venous plexus of veins will drain into internal vertebral venous plexus. So, this single diagram is giving you the correct outline of all the tributaries. It is giving you the correct outline of all the tributaries and all the draining channels and communications of the cavernous sinus. So, the MCQ which has been asked from this topic was direct tributaries. What are the name of direct tributaries and what are the draining channels? Or they can ask, like giving you the various options, and they will ask you directly it is drained by, it receives blood from which sources. Then you have to mark the draining channels as the answer. Why? Because they are lying in communications and draining, but direct tributaries are from three sources: orbit, meninges, and from the brain. Yeah. So, done with this. Now, important communications. So, many important communications of cavernous sinus are there. I want to highlight one of the communications which is more important. So, one of the communication is facial vein. So, we have got facial vein. Actually, we know that facial vein is forming a route of infection. Actually what happens, through the superior ophthalmic vein, angular vein, what happens, the facial vein will drain the infection. So that is happening by two routes. Facial vein will drain the infection by two routes. One is superior ophthalmic vein and angular vein, and the other is via pterygoid venous plexus of veins, which is draining the deep facial vein. So actually we have got the many emissary veins are also passing. So actually what happens, cavernous sinus, actually facial vein will drain infections from the danger area of the face via, it can get connections from superior ophthalmic vein, angular vein, or via pterygoid venous plexus drain the deep facial vein. These are certain important routes of communication. Same way cavernous sinus, as we know that superficial middle cerebral vein. So what is important is superficial middle cerebral vein is also form a superficial middle cerebral vein. Superficial middle cerebral vein can also form a route of communication via superior anastomotic vein, via superior anastomotic vein. So via superior anastomotic vein of Trollard, it can form a communication, for the superior sagittal sinus. So so this is facial vein is one mode, the other is superficial middle cerebral vein through superior anastomotic vein of Trollard. The other communication can be pterygoid venous plexus of vein forming communication via the pterygoid venous plexus of veins forming communication via which form communication via emissary veins. These emissary vein is passing via foramen ovale, foramen ovale, foramen lacerum. So these are certain foramen through which these can form the communication. Like for other communication like transverse sinuses is connected via communication with superior petrosal sinus, The other communication which we have seen as a draining channel, that is via inferior petrosal sinus will form a route of communication of cavernous sinus to that of internal jugular vein, and we know that internal vertebral venous plexus will also form internal vertebral venous plexus will also form a communication via basilar venous plexus. Basilar venous plexus. So these are the routes of communications. Now I would like to show you a diagram which is a case of cavernous sinus thrombosis. What happens in case of infection draining to dural venous sinuses? We have seen various route of communication. So two sides cavernous sinus communicate. Emissary veins can carry infection from external vein to dural venous sinuses through pterygoid venous plexus, facial vein, deep facial vein, superior anastomotic vein. So all these will form communication, and this forms a route of infection reaching cavernous sinus. So it's a very grave condition, and the presentation of the patient will be the patient will having ophthalmoplegia. Why ophthalmoplegia? Why? Because involvement of the cranial nerve. So okay, so one of the important point which I will again show you this diagram of relations. Actually in case of cavernous sinus, let me just remove all these. You can see the important relation of arteries and the nerves. Okay, so it is important that you should just understand this relation. So see here, if I talk about the nerves which is located in the lateral wall. So see here, we have got abducen nerve. So this is abducen nerve. Okay, so this is abducen nerve, and this is the internal carotid artery. This is ICA. So what you can say, internal carotid artery and abducen nerve is passing through and through cavernous sinus. Very important for MCQ. Two structures which is passing through and through. Ashwani Mishra, yeah, third, fourth will be lying in the lateral wall. I am talking about the structure which is passing through and through the cavernous sinus. So So means passing through, the two structures are passing through. One is abducent nerve and the other is internal carotid artery. When we are talking about the structures related in the lateral wall, so following nerves are related in the lateral wall of the cavernous sinus. Following nerves, what are these? Following nerves are related. So the nerves are oculomotor nerve, trochlear nerve, the ophthalmic division of fifth cranial nerve and the maxillary division of fifth cranial nerve. So these four nerves are lying in the lateral wall. So lateral wall of cavernous sinus will have four nerves, that is the third cranial nerve, the fourth cranial nerve, the sixth, we have got the fourth cranial nerve, the two of the divisions of maxillary and the ophthalmic division of trigeminal nerve. The sixth and the internal carotid artery is traversing to and through cavernous sinus. So these are the relation of important nerves related. So in case of cavernous sinus thrombosis, we already know the nerves which is lying in the lateral wall will be involved and which are passing, you can say through it, which are passing through the cavernous sinus. So that means all the cranial nerves which is supplying extraocular muscles. So all the cranial nerves which is supplying extraocular muscle, we know that third cranial nerve along with SO4 and LR6. Okay, that means lateral rectus, abducent, superior oblique trochlear nerve and third cranial nerve. So all these will be involved and will lead to internal ophthalmoplegia. There will be more of systolic murmur, there will be exophthalmos, the patient will have exophthalmos protruding out of the eyeballs, there will be murmur heard at times of fracture, if there is a case of fracture of base of the skull. So at times there is fracture of base of skull, and in this region what happens, when there is fracture of base of skull, there can be communication formed. So there can be a communication, that is an anastomosis you can say, will be formed between the internal carotid artery and that of cavernous sinus. So cavernous sinus, that means the high flowing blood will flow into cavernous sinus, so from internal carotid artery, and will lead to cavernous sinus fistula kind of thing form. Communication is there, and in this case also there will be involvement of cranial nerve, exophthalmos, murmurs will be heard around the eye orbits and exophthalmos will be there. So these are basic clinical findings related with cavernous sinus. So my dear aspirants, and this is all for today's session, but before ending the session, I would like to give you the information. Now after half an hour, so just after half an hour, I am starting with the session of 7:30 p.m. that is the next orientation session. So in this session, I will just give you a overview how clinical MCQs will be asked in the next examination of 2023. So be ready for this and join me for the free session on the Unacademy platform. So how you are going to join? You can use my code ANAD10, which is an unlock code and also a referral code, so you can join the free session. Telegram group of Let's Crack NEET PG, Let's Crack NEET PG Telegram group you can join, and you can use my code to unlock the free session. What is the timing of the session? 7:30 p.m. I will discuss clinical anatomy MCQs there. So do join me for the session. All the best. And I would also like to give you information from tomorrow, that is 15th December. My dear aspirants, from tomorrow, that is 15th December, I am starting plus course on Unacademy, plus course, that is a Focus FMG 2022 comprehensive batch. So student interested for the comprehensive batch of Focus FMG 2022 can definitely join and take the subscription. They can use my code ANAD10 and can get 10% discount. They can use my code and they can get 10% discount. That will be good for taking the subscription. Okay, so that would be highly important for you. And also what you can say, the plus and the iconic subscription has pricing detail is there. Okay Mulai, so what I have done with the subarcanoid cistern today, all the types of subarcanoid cistern I have completed. So, and I have completed the arcanoid pia and the cavernous sinus. We have discussed the cavernous sinus relations, cavernous sinus extents, cavernous sinus tributaries, draining channels. We have discussed different kinds of subarcanoid systems, cerebromedullary system, pontine system, interpedicular system, Cisterna Magna, Cisterna ambiens, Laminar terminalis system, Chasmatic system. So many things has been done. So those who have missed out, they can see the YouTube session once more, don't worry, and be ready today for 7:30 p.m. special class where I am going to discuss clinical anatomy MCQs. So those who want to take the session or they want to go for the plus course, they can use my code ANAT10 and get an additional discount of 10%. That means more than 20% discount can be grabbed by you. So don't miss this chance of golden opportunity. Take the subscription, be the part of Focus FMG 2022 comprehensive batch and get 10% discount by using the code. So all the best, keep studying. Thank you so much. So already done, so don't worry Mulai, you can, I'm just going to end the session. So this was today was not an MCQ session, this was a theory kind of session. So already described all the important cisterns, location, what is subarachnoid cistern, where substantial amount of CSF is there and there is dilatation of subarachnoid space, there is more amount of CSF located. So important location, what structures lying, and the different folds of the Pyromater, the cavernous sinus location, the applied and clinical view, all these has been done for today's session. All the best. Oh yes, Ashwani Mishra, okay, it's so this is all for today's session, already describe all the important things, so go for it and just download the PDF notes. So if you are seeing the session on the free platform, so you can come for the free session, okay, Ashwani Mishra, you can come for the free session. Now I am going to take the free session 7:30 p.m. join me live. All the best, keep studying. Thank you my dear aspirants, all the best. Thank you my dear aspirants, thank you.